Hi, I'm Christy Turner. We are on Chapter 8, Flexibility Training. First, determining flexibility. There are three things to help us determine flexibility. It has to do with age, gender, and your exercise history. As we age, our flexibility changes. Now that could have to do with a sedentary lifestyle. It could have to do with joint health or hormonal reasons. Gender, just by design, females are more flexible than men. Given certain joints, bone placements, they have a greater range of motion in their pelvis, their elbows, and their trunks. And exercise history, physically active individuals are just more likely to have a greater range of motion than a sedentary individual, and that is because they go out and they use their muscles. Flexibility training benefits and risks. Benefits of flexibility are decreased risk of injury, reduced muscle tension, increased range of movement around a joint, enhanced muscular coordination, increased circulation, increased energy levels, delayed onset of fatigue, enhanced performance in daily life, improved posture, and mental relaxation. Now, when it comes to flexibility training, you want to be sure that you are taking into account certain safety guidelines. You want to look at how you're isolating a certain body part and how you're leveraging it. We all have different musculoskeletal injuries, so depending on how you are trying to stretch one area, in stretching your hamstring, you may increase the amount of tension on the knee joint where you have an injury. Things like that you want to take into account in terms of maybe doing a hip flexor stretch that has you holding in the knee. Someone may not be able to do that. So isolating a certain area of the body isn't always safe. And also leverage is the intensity and the speed of the stretch. Keeping in consideration isolation and leverage help us to determine the safety of any given stretch. Now, the risks of stretching are causing too much stress. Sometimes people like to hold their breath. We've said this a million times during this. It increases blood pressure. Also, you can put too much stress on the joint around or the muscles themselves. Now, certain risky stretches are listed in your book. They're a good example of not saying you can't do them, but they aren't for everybody. Just like some exercises, some activities aren't for everybody. So check out the ones that are in your book and take note of why they are risky and who they're not really recommended for. Now, guidelines for flexibility training. Based on the American College of Sports Medicine, you always want to warm up. You want to stretch major muscles. You want to focus on the muscles and the joints that have a reduced range of motion. You want to work on those. You want to stretch a minimum of 2 to 3 times a week, if not every day. You want to stretch to discomfort. Hold the stretch for 15 to 30 seconds and stretch 2 to 4 times for each muscle group. And again, avoid holding your breath. So in terms of a quality training program for flexibility, you want to make sure it involves a warm-up, that there's attention to breathing, the duration of the stretch, the body's posture to maintain the stretch, and the order in which you do these. So starting with the warm-up, just as you would do in running or weightlifting, you need to warm up the body's core temperature. A warm muscle will stretch, a cold muscle will not. So you can warm up for stretching by doing some dynamic movements. And we'll go through the different types of stretches that you can do that may be better suited for a warm-up of a stretching, of flexibility routine. And for certain, avoid active stretches and isometric stretches. They should not be part of your warm-up, and they can be counterproductive to your flexibility routine or to your exercise performance if done in a warm-up setting. Now, breathing. Breathing helps to relax the body. It helps to remove toxins from the muscles, a buildup of lactic acid, other byproducts. It also increases the blood flow that our heart's working so hard to move. By breathing, we're encouraging blood flow. So you want to take slow, deliberate breaths when you stretch. You want to make sure you inhale slowly through the nose, exhale out of the abdomen, not squeezing the ribs together. You want to press up from the abdomen using your diaphragm. You want to make sure you give your body a chance to hold on to that breath, and then exhale out through the nose. Typically, in a stretch, you want to make sure you are maintaining a normal breathing process throughout the stretch. Now, posture. A simple change in your posture, just like with strength training, can change the outcome of the stretch. So just as if you were trying to do a tricep kickback here and you lift up, you're no longer working in your tricep. The same can happen with a stretch. So you want to maintain neutral positions of the spine. You don't want to put too much pressure or tension in certain areas. You want to keep the shoulders open, the hips square, and you don't want to lock out any joints. Now, the order that you want to stretch in serves a purpose. If you go to a stretching class, a yoga class, there's a typical series of stretches that you'll do. The reason that you want to do that is you want to stretch a certain muscle, but one muscle may have a few other muscles that help it out. And so you want to make sure you stretch out the helping muscles first so that you can really work on the true range of motion for the muscle that you're targeting. Now, the suggested order, this is in your book, stretch your back, upper and lower first. We have a tendency to use our back. In trying to stretch the hamstrings by reaching down to our toes, we end up stretching our back more than anything. So you want to make sure that the back's already stretched out so you can maximize the hamstring stretch. Stretch your sides after stretching your back. Stretch your buttocks before stretching your groin or hamstrings. They will limit the range of motion in the hip if you don't. Stretching the calves before the hamstrings. You will remember the gastrocnemius, the hamstring, it's a double joint muscle. The shins before your quadriceps, and the arms before your chest.